Hi, this is Dr. O'Malley with Great Oral Health, Inc. And today I want to talk to you a little bit about the basics of dental anatomy. I get a lot of people that ask me, now what is the enamel? Now there's enamel and then there's dentin and heck, why do I have to floss? Oh, I know why, because my dentist told me I need to floss. Every time I go to see my dentist, I usually floss for a day or two before I see him, and then I can say, yeah, I floss. You know, I mean, I'm a dentist. I hear that all the time, right? You know, but I'm going to explain to you why flossing is important right after I give you a real basic general anatomy bit of information on the structures of the teeth and the gums and things like that. Okay, here we go. So you'll have to excuse, this is my personal drawing myself. I didn't have a professional person come in and do this. I'm doing this myself, but I think the data is important enough that it can overcome maybe the lack of my perfect artistry. Okay, so let's look at some of the basics here. So here we have a typical molar enlarged for our instructional video. And we show on the outer surface of a molar we have a substance that's called enamel. Now the enamel is the hardest structure in the body. It's twice as hard as the bone. And so the purpose of the enamel is to supercoat and cover the tooth and keep it protected against acidic foods, chewing, rubbing the teeth, basic eating for a lifetime. And it could be a long lifetime. You know, if you live to be 100, 120 years, it'd be a long lifetime. And by the way, anybody out there listening, a lot of people used to think that as they get older, this is by survey when I used to practice in West Texas some years ago, I would ask them, you know, what do you think about your teeth? How do you like your teeth? Do you think, you know, what's your long-term goal? And many would say, well, I want to keep them as healthy as I can until I get older, then I know I'm going to lose them. And that's actually not true. So Mother Nature made the teeth strong enough and hard enough to last a very healthy, long lifetime. Part of it is this hard outer structure, the enamel. It's very important, and we don't want it to erode away or go away. So there's certain things you can do. That's brushing. That would be keeping your teeth clean. And that would be if you're a grinder, you want to make sure you get a night guard made from your dentist to protect that enamel. So the outer surface is enamel. Now inside, there's a second layer, and some of you anatomy buffs out there, you're going to know what this is. This is called the dentin. The dentin acts as a shock absorber. This is sort of like a football helmet on the outside, and we have the softer material inside. And what is it protecting? The pulp, or the nerve of the tooth. And this nerve of the tooth is what was there from its infancy. From being a young pup of a tooth, it grew all the way up into a full tooth, and that was the blood supply to help it grow and expand and go hopefully in the right position. And it stays alive. It's actually connected to a blood vessel that goes just outside of the roots. There's a blood vessel that feeds this nerve, and inside the dentin. By the way, dentin just means indent, which means in the tooth. So it's not a mysterious, weird word. So inside the dentin, there's these little dentinal tubules. They're just tubes filled with solution. And that solution communicates with the nerve down through the entire tooth. And it's sort of a hydrodynamic aspect of the tooth. That just means it keeps this whole structure, the inside part, moistened, which allows it to have flexation, flexibility. Without that flexibility, it would break off. Okay? And any of you that have had a root canal, you lose this, the hydrodynamic, that just is the principles involving the flows of water and fluids. That goes away, and so the tooth becomes brittle. So we want to keep this intact as best we can because it keeps this moistened. So we have the dentin and we have the dentinal tubules. Anybody that's ever had a little cavity and the dentist didn't numb it or they rubbed in there themselves, it can be a little bit tender. That's because these dentinal tubules filled with solution, it's sort of like a straw. If you took a straw and filled it with water, you can push on one side and feel it on the other side. So if you touch here, it feels like the nerve is being touched. That's all, and that's what's happening there, okay? Then around the root, we have the gum. So the gum acts like sort of like a turtleneck sweater. It wraps all around that tooth, and it keeps bacteria from going inside and down and around and penetrating and getting around the root, which then could cause gum recession, it can cause infection, pain, etc. So that gum is really important. How do we keep the gum healthy? So the bacteria are smart. In our mouth, there's hundreds and hundreds of strains of different types of bacteria in the mouth. And if they get out of balance, it's not good. So we want to keep them in balance. How do we do that? Usually by keeping the mouth in a good pH range and not having infection. Okay, so the bacteria, they want to survive just like any other living organism does. They know your toothbrush is going in there every day. So where are they going to hide? Well, they're going to actually literally, I don't know if we can see this on the model here, but they're actually going to hide in between the teeth. Okay? Because they know that toothbrush is coming. So they go, uh-oh, it's morning time, it's nighttime, I'm going to go hide in there. And they hide in there. And if you don't run the floss through there, you can't break those bacteria apart. Because it literally takes your bacteria 24 hours to form a big enough group. And that big, huge group then begins to lay acids down, and they're byproducts. And those byproducts can cause inflammation down around the gum area. This can get red and puffy. People that have gingivitis, that's anything with itis at the end means inflammation of. Gingiva is the gum, so they have inflammation of the gum. And that's from the bacteria wedging down in here. It starts bleeding, and then the patients get a little afraid to brush in there because, oh, my gums are bleeding, I better not brush. But actually, you should brush heavier and flush that out and clean it out. But back to the dental flossing. Why dental flossing? A lot of people say, well, because my dentist told me I'm supposed to, it's the right thing to do, and various other answers, right? I'm going to tell you the real reason. Oh, another one is, I think it's to get food particles out. It does help with that. But the real thing is, remember I've told you it takes 24 hours for those bacteria to come together. Flossing breaks them apart. And once you break them apart, they don't know what to do. They're kind of traumatized by it or something, I suppose. They just drift around, and then finally they go, hey, let's get back together again. It takes them 24 hours. But there you are, flossing again, breaking them apart. And so it's sort of a dance, and you get to be in charge of that, and you win, and then that actually helps bring about better health. You won't get this inflammation down near the gums. The bleeding will go away. Those are all signs of health. By the way, anybody that has bleeding gums out there, it is completely not healthy. It would be the same as if you combed your hair and you looked in your comb and you had blood in your comb. You'd go, gosh, that's not right. But how many people out there have just a little bit of bleeding gums? Should not be any. Should be able to brush and floss. If there's bleeding gums, it's an overgrowth of the bacteria. So I hope this has helped you understand why you floss, and it will also give you fresher breath and healthier teeth, hopefully for life. Thank you very much.